Welcome to the California Health Interview Survey, CHIS Advanced Data User Webinar. I'm Peggy Toy, Director of Health Data, a public service program of the UCLA Center for Health Policy Research, and I'm one of your presenters today. On behalf of the center, I want to thank the California Endowment for its support of the California Health Interview Survey and today's webinar. The survey is the largest state survey for population-based health data, and the data is widely available. We're going to demonstrate advanced features of the online tools to access CHIS data, and these include AskCHIS, which is the health data query system, AskCHIS Neighborhood Edition, which is a GIS search tool, and CHIS data products for advanced users. Joining me today for our presentations, I will be presenting on AskCHIS, and joining me will be Jacob Rosales, who will be demonstrating AskCHIS Neighborhood Edition. And we have the CHIS team here who will demonstrate or present the CHIS data products for advanced users, Jian Yu, Parneet Guman, and Zebri Jiang. The California Health Interview Survey is, as mentioned, the largest survey of health data. And I want to say that we will be opening for questions after the online tools are presented, and then again after we review the advanced topics, products for advanced users. And at the end of the webinar, we'll have a brief survey for your feedback. So I want to tell you a bit more about the California Health Interview Survey. There are more than 20,000 Californians participate in the survey each cycle, about every 1 or 2 years. They're interviewed on a wide range of health topics, and you can see some of those topics are displayed here. Survey participants include adults, teenagers with parents' permission, and children by parent proxy. CHIS is conducted in multiple languages, including English, Spanish, Chinese, both Cantonese and Mandarin dialects, as well as Korean, Vietnamese, and Tagalog. I'm going to go to the home page for CHIS. So you can see that in the Center for Health Policy Research, we have the California Health Interview Survey, AskCHIS, and other information right on the menu bar at the top. And we're going to be exploring some of the other information that's available. But I wanted to introduce you to the CHIS page where you can get information about the survey. You can look at the survey design and methods, as well as copies of the questionnaire and methodology. Other ways to access this data, which we'll be talking about, and publications. So
Peggy, it seems like your screen sharing is not working. Can you restart the screen sharing, please?
Sure. All right, can you see that?
Yes, thank you.
All right, thank you. This is the landing page I was talking about, and we're going to, I want to introduce this page to you so you can see where you can get more information about CHIS. As I mentioned, survey design and methods, as well as copies of the questionnaires and other topics related to the survey. We're going to get into AskCHIS, other ways to access the data, as well as publications. And there's also a learning center where there are videos and technical assistance articles. We're going to go right into AskCHIS, and we'll be coming back into this area where we're going to take a look at other sources of CHIS data and how to analyze CHIS data using some of the methods that are products that are available to advanced users. I'm going to select AskCHIS, and I think I have to stop sharing and come back in. Okay, here we are. All right, so here we are on the landing page for AskCHIS. and also AskCHIS Neighborhood Edition. So as you can see, this is where you enter AskCHIS, and I've already set up my account for AskCHIS, which also gives entry, use the same access for Neighborhood Edition. But by creating your account, you will be able to save to your library all of the queries that you produce using AskCHIS, and the same thing for Neighborhood Edition. So I'm going to log in here. So you can see this is the landing page for AskCHIS. You can see the variables that make up the construction of a query to produce estimates from CHIS data. And you can see we start off with our geographic area. It defaults to the state. And you can see that we have all counties in California listed here. They're clustered by region. You can also get lower level data from in Los Angeles County, the service planning areas, and San Diego County health regions. So for today's webinar, I'm interested in psychological distress among different sexual orientation populations. So I'm going to show you how to access the topics. So the next area on this landing page is selecting a topic. You can search for a topic using keywords, but I like to explore the categories of data that's available to me to see which one matches my interests. And you can see a number of categories that's listed here. CHIS data evolves as new topics are of interest to users. And as you can see here, we have COVID and other health topics, as well as behaviors, access to services, insurance, mental and emotional health, and other topics here. So I'm interested in psychological distress for today. And we can see that when I select that category, a number of subcategories come up. And I'm going to select emotional well-being. So we can see we have a number of questions that were asked under this category. The first that comes up is always the most recent data, which we have here at 2020. Likely has had serious psychological distress in the past year, social impairment, number of days unable to work, and so on. There's a number of questions asked in this category. I'm going to select likely has had a psychological distress in the past year. And when we click on the button, we can see more detail about this question. It was asked over 6 years. For each of 6 years, starting in 2015, it was asked of teens and adults. And the two results are likely to have had a serious psychological distress or not. And when you click on the More button, we can see more detail about how this variable is constructed. And that is, it uses the Kessler-6 series, which is a measure of psychological distress, which is commonly used. And this has been applied to ask respondents did they experience psychological distress within the past year. So I'm going to select that as my topic. Now, to get at psychological distress among various sexual orientations, I need to compare how the responses are to that question among that population. So I'm going to select compare topics. And again, I'm going to select demographic. This is where I can get at the different population characteristics. And we can see a number of those displayed here. I'm going to select sexual orientation and gender identity. So we can see there are a number of questions asked within this category. Sexual orientation shows us 4 levels. Gender identity, this is transgender or not transgender. And you note that for this particular category, you're asked to pull multiple years. It's recommended to stabilize estimates. And there are a number of other questions within this category. But I'm going to select sexual orientation because it gives us 4 levels of self-reported sexual orientation. And we can see the years that it was asked, This was asked specifically of adults. And here our categories are straight, heterosexual, gay, lesbian, homosexual, bisexual, or not sexual, or other categories. So it helps us to see what was asked. It says, do you think of yourself as straight, heterosexual, gay, lesbian, homosexual, bisexual? So it's really helpful to read the question. And again, the consistent question that's asked for all 6 years, and helpful if you want to trend the data over a period of time, over these 6 years. So now this data is defaulted to the state. We have our topic we're going to take a look at among sexual orientations, and this 1 year, 2020, the most recent year. So we can see our result. Now, this is the state of California, and we can see that for each one of the sexual orientation categories, you can see the estimate for those reporting that they experience psychological distress in the last year. And we can see from this chart that our estimate shows within each category the estimated number that of those within straight or heterosexual that said yes, that they experience psychological distress. We have our confidence interval, which you can see here. It's a very narrow interval, and the estimate of the total population as represented with this estimate. But we can see across the board for each category, the percentage of those within each category reporting that they experience psychological distress in the last year. This really helps us to see not just how that population is represented. So let's say we take a look at transposing the topic under a just layout and take another look at the data. If we want to see those that have serious psychological distress within the last year, and these categories represented their percentage within that within the responses to that question, it gives us one look at the data, but doesn't tell us what we really want to know is what is the level of psychological distress among specific sexual orientations. So we'll go back to transposing our topic. Now we have the state of California, but let's say we want to look at a more local area. So we're going to revisit our geographic categories, and I'm going to just select Northern Sierra counties. This is up with all of these smaller counties up in the northern part of California. And we're going to take a look at the data for that area. And as you can see, the pop-up message tells us that we have unstable estimates, which is denoted by an asterisk, and just recommends against reporting or relying on estimates that are statistically unstable. But it gives us some tips on how to stabilize the estimates. You may combine 2 or more years of data or collapse levels. So pooling area is recommended for this population. But if we were looking at something else like maybe race or ethnicity, we may want to collapse populations that are unstable so that we can take a look at stabilizing a group, a cohort, or cluster cohort of populations along in comparison with those where we have stable estimates. But for our purposes today, we're going to pool our years. Again, looking at California, we have stable estimates, but let's take a look at pooling our years so that we can increase the sample size to stabilize our estimate. So we're going to select all 6 years that this question was asked. And what we want to do is select pool. So and as we can see here, our estimates have been stabilized for each one of our categories. One of the things that we may want to do with this data is take a look at the distribution. There are other ways to display the data that may not be useful since we only have one topic that we are looking at, and very distinct populations where we have stable estimates. But you can use the bar chart or pie chart, and you can trend the data by uh, taking a look at the years in which this topic was asked among our population. And so let's take a look at our other ways that we can use the data. We can compare with California compared to the state. And we can see similar rates in comparing each one of our populations by the state of California, comparing Northern California, Sierra counties with the entire state. It's very similar rates of reporting likely to have distress, psychological distress. Let's see if we can get at the trending. The trend, I'm going to transpose the topics. So we want to see, and I'm going to remove the compare state and just show our geographic area of interest. Let's see if we can trend the data. First thing we need to do is go back to compare years. Now, again, we have unstable estimates because, as we'll see, in many of the years, the data is unstable. But I'm showing this to demonstrate how to create a trend line using this feature in AskCHIS. So we want to see likely has serious psychological distress. So we can see it's been fairly stable across the years. And even though this is an unstable estimate, but and may not be useful for our purposes, but to demonstrate the trend line, it shows that you can utilize AskCHIS for topics that have been asked over a period of years and show how they trend over time and for each one of our populations. Other things that you can do with the data, I'm going to go back to our data display, and I'm going to transpose, going back to our topic of interest, which is a serious psychological distress. And I go back to pooling our years, because this is the data I want to get at. Other things we can do is we can export it into an Excel spreadsheet. So here we have a chart. We may want to use this to do other queries where we're looking at perhaps intersectionality with the different orientation by race, ethnicity, or other variables that we want to consider. Go back. All right. And finally, we can save it to our library. This has been really helpful. As you can see, I have many of the charts I've used in the past saved to my library, which has really been helpful if I'm going to report or do a further analysis or even doing our webinars. It's been very helpful to save past queries and to explore them more or to build on them. So with that, I'm going to stop sharing and I'm going to hand it off to Jacob Rosales, who's going to go over Neighborhood Edition.
Thanks, Becky. Good afternoon, good morning, folks. My name is Jacob Rosales. I am the CHIS Data Dissemination Manager, and I'll be going over AskCHIS Neighborhood Edition. Let me get my screen shared. You see here, this is the login for AskCHIS Neighborhood Edition, also referred to as AskCHIS NE. I'll probably be saying AskCHIS NE, so if I do Neighborhood Edition. The login, you only need one login for AskCHIS or AskCHIS NE. It's the same login. So that's the login page. You log in. You'll see here is the landing page for AskCHIS Neighborhood Edition. One thing I want to mention about AskCHIS NE is a big difference between the AskCHIS platform that Peggy was presenting and AskCHIS Neighborhood Edition, and that's specifically the estimates that you're receiving. On the AskCHIS platform, those are direct weighted survey estimates. Those are direct estimates from the survey data, whereas AskCHIS Neighborhood Edition are modeled small area estimates. We provide small area estimates for different geographies, much smaller geographies than what you'll see in AskCHIS. We're modeling estimates for the state, counties, cities, zip codes, legislative districts, those being your your state Senate districts, your state assembly districts, and your congressional districts, as well as we provide modeled estimates for census tracts. The census tracts estimates are available only back from 2016. So we have data for 2016 and 2018, and soon to be released in 2020. The 2020 estimates will soon to be released end of July of this year. So for census tracts, you can only go back to 2016, whereas for all the other estimates, state, county, zip code, legislative districts, those go back to 2012. Now I'm going to talk about running some estimates, getting some health indicators, as well as a sociodemographic real quick, and just kind of going over the real quick and easy, getting some estimates for different geographies, like say county and city. So I'm interested in looking at health status. So here I'll go to health topic, health status. I want the most up to date. So I'm going to do fair, poor health, 18 and 64-year-olds. And I'm also going to look at some sociodemographics. We have an array of different sociodemographics. Please note the sociodemographics are coming from the American Community Survey. That's a product from the census. I'm going to look at ethnicity. Specifically, I'm going to look at Hispanic, Latino, 18 and older. So I'll pull that up, and you see when I run these, I get the statewide estimates. Now to add other geographies, what I can do here is I go to a location, and I'm just going to look up Los Angeles. You see here, I get these little pills, one for Los Angeles and different cities that contain the word Los Angeles. So I'm just going to throw in Los Angeles County and Los Angeles City in there. And to have them come down here, it's just into your selection area. You just have to select on that pill and it'll pop in. To remove them, you see the little X out, you can remove them. So I'll create my table and map. You see here the data table is showing for specifically Hispanic Latino by city. So you get a map that generates a ChlorPuff map of all the different cities in California. You also have a histogram down here. You can control this histogram and essentially filter out. So if you just want to focus on those that are at the Los Angeles level or below, or maybe just at the state threshold or below. You also notice we have this this graph here that essentially shows the different geographies that you selected, colored so that state is in blue, county is in green, and cities are in red, to kind of compare the state baseline and compare those other geographies. Now I'm going to show you how you can go about selecting census tracts. I just go to location, and you see here you have different things. You can combine different locations. So you can combine, maybe you want to look at, like, say, a handful of counties in Southern California. You can do that through the combined locations. You have a find legislative district, because some people aren't sure where their legislative district is. So we have a feature where you can just type in your address, and it'll say, this is the specific congressional district you're in. This is the specific assembly district, a specific state Senate district. And then we also have census tracts. So in this search, I'm interested in comparing a census tract in Marina Del Rey with the census tract in Boyle Heights. Those are both areas in Los Angeles County. Here we have a search by address. I'm going to search for this Marina Del Rey census tract. See, it pops up, it pins it down. And now I'm going to add selected tracts individually. I add that down there, and you see it plugs that in there. And now I'm going to search for this Boyle Heights address that I have that's in the census tract in Boyle Heights. Run it through the search, it finds it. Make sure It pops in there. I'm going to add that, and now I will create my table. And as you see here, it reruns. And essentially it shows that the map is showing Hispanic and Latino, percent of the population is Hispanic or Latino. And you see here the Boyle Heights compared to the Marina Del Rey, much higher percentage of Hispanic Latinos, overwhelmingly Hispanic Latino in this specific tract. You'll notice here, if I toggle through on the cells and click on the cells, it's going to change the core path to what that cell represents. So here, this is Los Angeles, this is the tract in Boyle Heights, and it's showing fair poor health now. You can toggle out to get a better view and to see more of LA County and more of the tracts. And again, I can use the histogram to filter out. So maybe I want to focus on those that have a low percentage of fair or poor health, or filter out for those that have a high percentage of fair or poor health. If I click on the Marina Del Rey tract, it's going to take me specific to that tract, zoom in, and I can zoom out to get a better lay of the land. Now, one thing you'll notice is that in certain areas, and it's usually in the bigger communities, the bigger cities, Los Angeles, San Diego, San Francisco, Sacramento, there's lots of different neighborhoods, lots of different areas. Sometimes census tracts can be real in big cities like Los Angeles. Sometimes census tracts don't capture the entirety of a neighborhood. So, for example, this tract that I selected in Boyle Heights is just a small piece of the pie of Boyle Heights. And maybe I want to get a better idea of what Boyle Heights looks like for these specific indicators that I selected. Now, I could use the zip codes, but the one thing with zip codes is sometimes they're way too big. So the good thing is we have this pooling application. You can combine the census tracts. So I'm going to remove the Boyle Heights tract from my current selection down here. And I'm just going to go back to the map and select that. But what I'm going to do is I'm going to select multiple tracts and make a combined pooled tract, like a bigger, larger tract that for essentially can be a proxy for Boyle Heights. You'll notice that sometimes these census tracts don't fit in perfectly to the communities, but they can do a much better job of kind of creating a neighborhood. So I'm just going to select these different areas, and I can do it with the pointer tool, or I can also, we have a lasso tool here. And I can use this lasso tool to quickly select all these tracts. And now you see I've essentially lassoed this area. And now what I can do is I can combine my selected tracts. Combine the tracts, and you'll see that it'll essentially name it Census Tract Group 1, which is what I'm going to call Boyle Heights. And so now you see in my data table here, it provides an estimate of all those combined tracts for Hispanic or Latino, as well as the prevalence of fair poor health in that tract for adults 18 to 64. I can toggle on the different cells to switch it over. So now I'm toggling over. So now the map is presenting a core pleth for those persons 18 to 64 in the tracts, and also my census tract group that the prevalence of fair poor health for those. One last thing I want to hit upon is we also have a library feature in here. So maybe you're working on this and you have to, for whatever reason, stop, or you just want to do a little bit of work on it. We don't want you to recreate the wheel every time. You may have like started something and you need to move on to another project. So we have a libraries section here. You can save this table to your library. I'll name it. I think there's a 50 character limit here. So I'll just call it health status Boyle Heights versus. Yeah, it's about right. Save it. It says that my dashboard was successfully added to my library. I can just close out of this. And now if I move on and the next day I want to work onto it, maybe add some other geographies or whatnot, I can just go up to my account here, go to my library, queue that up, and it's going to reload everything. It's going to have my maps. It's going to save the census tract grouping. And then if I want to add other health indicators, environmental factors that we have, or the vulnerability indices, you can do that. You can build upon it. So we really don't want you all to recreate the wheel every time. You have the ability to save, as well as we have other features. You can export your table as a CSV file. So you might notice for this example, I'm just sticking to the fair poor health indicator and the Hispanic Latino ethnicity. But I can add as many indicators and other sociodemographics as I want to this. The one thing is that you will see this table will get very, very long and it's hard to share, but you can make this table as robust as you want with regards to different indicators, environmental factors, sociodemographics, etc. And then you can spit that, you can export that as a .csv file. You also have the ability to export as a .png map or do a print to like a PDF if you want. So that is AskCHIS Neighborhood Edition and some of the more advanced features that we have. I'll send it over to Tiffany because I know we're going to be doing a Q&A on AskCHIS and AskCHIS Neighborhood Edition now.
Thank you, Jacob. Hi, my name is Tiffany Lopes. I'm the Director of Communications here at the UCLA Center for Health Policy Research. Just a reminder, if you have any questions about AskCHIS and AskCHIS NE, we're going to be going through those right now. We will be doing a second Q&A at the end of the next section. So if you have questions about some of those things, we'll tackle them in a little bit. So first question, is it possible? Oh, sorry, hold on. Previous surveys asked about perceived medical discrimination. Does that question still exist?
Jacob, why don't you take that one?
I believe we reinstated that question in, I believe we're going to have it available in 2021, if I'm not mistaken. I'm going to have to look back in my records on that because that's just off the top of my head. But I know in previous surveys, we did ask about discrimination in medical encounters, and I believe that we are bringing that back into the fold.
Thank you. Can the GIS map in AskCHIS NE be exported?
I guess the question on that, so you can export as a .png image. If you're asking about whether or not it can be exported as a shape file, that is something that no. So it's just essentially, you're just gonna download the map with the view that you're on. And actually, you know what I can do? This will be real short and simple. I'm just gonna share my screen and give you an example of that. So you see here on my screen, essentially what's gonna happen is it's gonna take like a screen capture. So if you have your map set to wherever you, like however you have it filtered with the histogram, as well as the zoom in level, it's essentially just going to be, it's going to run this. You see here, it's saying, you know, okay, we're going to do that. I'm just going to save it there. And I'm just going to open this up real quick. And you shall see that your output is essentially going to be the same view that you have on that. So those are the limitations of the export. It's not a shape file. It's not really a GIS map. It's just a .png image. So those are really useful for like PowerPoint slides or other documents that you might be working on. So that's as far as the map exported or exportation goes. Thanks,
Jacob. The kind of similar question, is there API to consume AskCHIS NE into our own GIS? It's a lot of acronyms.
We do have an AskCHIS Neighborhood Edition API. Please touch base with us if you're interested in purchasing a license for that, and we can get the ball rolling and talk to you about kind of the type of project that you are working on.
Great. One question, somebody said that they missed it. When will the latest data be available in AskCHIS NE?
AskCHIS Neighborhood Edition, we will have 2020 estimates available end of July, early August.
And then just to let everyone know, as far as AskCHIS is concerned, once we do the annual release in late September, early October, those estimates will be added to that site. At the end, could you explain briefly how the data is modeled for AskCHIS NE? With what confidence can we report this data?
That is a question that I believe Zebri should answer. He's much more well-versed in the modeling aspect.
Yes, so I don't want to talk too much about the technical aspect for the AskCHIS NE, but you're welcome to email us. But briefly, we combine 3 sources of data to model those estimates here. The first one is our own CHIS data. And also we combine some neighborhood factors from the ACS data, and we model the estimates to data we purchased from a third source, which is like a population data. So by doing that, we can combine the health information we get from CHIS and also the community characteristics we have from ACS data to model those estimates. And again, if you want to learn the technical details of those model estimates, you are welcome to contact us, and we have some papers to share.
Thanks, Zebri. And I'm going to drop the CHIS email address in the chat in case anybody has any questions after this presentation and wants to reach out. Can you talk more about exploring the intersectionality of the data? For example, looking at 2 topics broken out by race/ethnicity. How do we do this in the platform? And I believe that question is for AskCHIS.
Okay. So maybe I can share my screen. You can take a look at, hold on a second. Here we go. So you can take a look at race, ethnicity, and compared topics. If you're looking at a specific topic, or so let's say you want to look at utilization of healthcare, for instance, and you would select. Let me select the main topic, and one of my favorites is utilization of healthcare. So, where is it? Here we go. Access and utilization, usual source of care. We'll just select this for this purpose. And so now we want to take a look at among race ethnicity. So as you can see, here are the different sources of race data. One is from the Department of Finance, the Census, and then UCLA, CHPR. The center developed their own metrics for race and ethnicity. The most commonly used is Department of Finance, Office of Management and Budget. And so they each have their characteristics. So with this one, you can see Latino, then white, Black, and other ethnic groups. The census, with the census, there is no Latino category. So this is a large population. It may not be useful for Californians and perhaps other populations. And then the center has, this is demographic, where they have Latino as well as others. And with the center's variable for race is who does the respondent, which category does the respondent most identifies with. So these are some of the sources of data that you can use for race ethnicity. And I'm going to just, so you can, that's one way to do it, is to show that within a particular category. And as I mentioned earlier, you may get some unstable estimates like American Indian, Alaska Native, and I think this is still California. You can also select your population from the limiting feature, which is, you can see each one of the racial categories are listed. It does use the Department of Finance, Office of Management and Budget, and you can select one or more races for your analysis. So those are 2 ways in which you can select race ethnicity for a topic that you're interested in.
Thank you, Peggy.
I hope that's helpful.
Jacob, could you provide details of the small area estimators models, variables and model, mathematical specification of models, and SAE estimators, statistical programming code?
That is every question. And again, I think that that's probably best done via email. That's going to be a lengthy response.
Yeah, feel free to email us with the technical detail, and we'll be happy to answer all the questions.
Sounds
so
good.
Tiffany, if I could make a suggestion at the time we are, maybe we can move over to our CHIS team, because they're going to be talking on some of the products that may be of interest to advanced users.
That sounds good. We're going to be doing Q&A at the end of that section, so we can revisit some of these questions as well that we haven't had a chance to answer. Apologies, folks. We have over 20 questions in the chat right now. So yeah, let's move on to the next section.
Okay. So I'm not going to share my screen. So who we have Jian-Yu, who's going to talk about the public use files. She'll be followed by Praneet Gilman, who's going to be talking about the Data Access Center, or the DAC. And then Zebri Jiang, who's going to talk about the pooling macro available with CHIS data. So I'm going to throw it now to Jian, who's going to start us off on the CHIS data products.
Thanks, Peggy. Hi, everyone. My name is Jian-Yu, and I'm the Research and Data Dissemination Coordinator at CHIS. The public use files that I'll introduce now are the files that contain data from each CHIS cycle that enable researchers to customize and run their own analysis. So these microdata files with individual respondents and variables are available in SAS, SPSS, and STATA data formats. I prepared a brief video to walk through how to access the public data files. So I'm going to go ahead and play that. Second. To access the PUF data, you can first go to our CHIS website at healthpolicy.ucla.edu/CHIS. When you click Get CHIS Data, you will see the section including a brief information about the PUF data. When you click the Download Now button, you will be directed to the login page where you can use your existing credentials or quickly create your free account. Once you log in, you will see this page titled Public Use Data Files. Scroll down and you will see available PUF options along with other data request options and more information on the citations and our methodology reports. Let's say we want to download the 2019 and 2020 CHIS data. Click on the link that says 2019 and 2020 CHIS data. On this page, you may first see the documentations related to 2019 and 2020 CHIS data. First is the data dictionary, where you can download the PDF files that includes the information on our CHIS variables. You may click the View button to download the data dictionary for each age group and each year of your interest. Next is the data dictionary for the constructed variables, where you can also click View to download the PDF files. The following section is our questionnaire, where you can click either phone or web to download the questionnaires used in our CHIS survey. If you scroll down, you'll see the section called 2-year data files. In order to access the 2-year PUF files, you must submit the application attached on this section. Once you click on the CHIS 2-year PUF surf application link, it will lead to our PDF application file. Please read through the first page. This includes information on the review process, review criteria, and costs. The second page is the application. Please download this PDF application, fill it out electronically, and email it to the CHIS Data Access Center at dacchpr@ucla.edu. Now let's go back to our website. Different from the 2-year PUF files, one-year data files can be downloaded directly from the website. In this gray table, you can select the age group, file format, and year to download the file. Let's say we want the CHIS 2020 adult PUF data file in a SAS format. When you click the Download Now button in the corresponding box, you will be directed to the Terms of Use page. Once you click I agree with Terms of Use, the data file will be downloaded to your computer. So yes, this was the end of the video. I will quickly hand over to Parneet Guman. She will discuss the CHIS Data Access Center.
Great, thank you so much to Yoon. My name is Parneet Guman, and I'm the Data Access Center Coordinator with CHIS. And I will be providing an overview for how to access confidential CHIS data via a Data Access Center project. The purpose of this video is to provide an overview of the Data Access Center and outline the steps for accessing confidential CHIS data via a Data Access Center, or DAC, project. The DAC provides researchers with an opportunity to have data analyzed from the California Health Interview Survey, or CHIS. The CHIS is a comprehensive health survey that contains a rich array of topics such as demographics, general health conditions, mental health, health behaviors, health insurance access and utilization, employment, and many more. The DAC produces separate data files for our public use files, or PUFs, and confidential data files. PUFs contain data at the state level and are not considered to be very identifiable and/or sensitive. PUFs can be downloaded directly from our website. Data that are not available in the PUFs can be accessed via our confidential data files, which are considered to be more identifiable and/or sensitive and can also be analyzed at sub-state geographic levels. Confidential data do not include any direct identifiers such as full name, telephone number, or date of birth. The DAC has had its own IRB since 2009 and is a restricted area, both physically and remotely, to ensure the security and confidentiality of CHIS data. The DAC is where data files are prepared for analysis, data requests are fulfilled for approved DAC projects, and data disclosure review takes place for all outgoing files. DAC projects are available by application via our DAC Online portal, and all applications must go through a committee review process to receive approval. One thing to note about DAC projects is that researchers do not actually receive access to any raw confidential data. Instead, each DAC project is assigned to 2 statisticians from the CHIS team who will run all requested analyses within the Data Access Center and return completed output to the researcher via the DAC Online portal. Researchers can either write and submit their codes to be run within the DAC or have their assigned statisticians do the programming instead. Another thing to note is that there are costs associated with pursuing DAC projects that vary by type of service rendered. To apply for a DAC project, open your web browser and type in www.healthpolicy.ucla.edu/CHIS. Then navigate to the California Health Interview Survey tab and select Get CHIS Data. On the right side of the screen, click on the green DAC Online User Portal button. You will be directed to log into your account. If you do not have an account, there is also an option to register for one on this page. The Apply to Use Confidential Data page is where you can get more information about and apply for a DAC project. Please note that the required application materials include a master variable list, non-disclosure agreement, research proposal, cover letter, and biographical sketch or resume. Researchers who are pursuing a DAC project for a school-related assignment, such as a thesis or a dissertation, are eligible for our DAC Student Scholarship. Student researchers are also required to submit their own programs to their assigned statisticians. More information about the DAC Student Scholarship can be found in the Additional Student Application Requirements section. Furthermore, information about DAC rates and fees can be found under the Project Costs section. Once you have read through all of the details on this page, click on the Apply Here button to begin the DAC project application. On the Principal Investigator tab, please fill out the contact information and affiliation of the principal investigator. On the Co-Investigators tab, please add the co-investigators who will also have access to CHIS output, if any, by clicking on the Add Co-Investigator button. Then select the person who should be the primary contact for this DAC project from the drop-down list. On the Research Project tab, please provide information about your DAC project, such as title, funding status, funding source, study population, CHIS years of interest, type of statistical services, and packages requested, as well as a brief summary of the services requested. Please also include keywords that describe your project for the CHIS Project Depot. Please also note that you can save and exit the application at any time by clicking on the Save and Close button at the bottom of the application. On the Project Details tab, please add short summaries about the background, key hypotheses, methods, variable justification, any files to be merged with CHIS data, and publication plans for your DAC project. On the Uploads tab, please upload your cover letter, research or grant proposal, current biosketch or resume, CHIS master variable list, and non-disclosure agreement. If you are applying for a DAC student scholarship, check the Are You a Student box and upload a faculty sponsorship letter, as well as the student scholarship application. If you simply want to upload optional additional documents, you can also do that here. On the Summary tab, please take a moment to review all details in your DAC project application. If needed, you can go to a previous step of your application by clicking on the Previous Step button. Once you are ready to submit your DAC project application, click on the green Submit button. Upon submission, you will be directed to a confirmation page where you can click on the link to go to your user dashboard. On your user dashboard, you can see the unique DAC number of your application and review its status. DAC project applications are reviewed by Data Disclosure Review Committee, or DDRC, which is comprised of internal and external stakeholders, statisticians, and researchers. This committee performs an extensive review of each submission to ensure that the project is feasible, does not risk the confidentiality of respondents, and aligns with the goals of CHIS. These reviews take place on a bi-weekly basis, so it can take up to 2 weeks to hear back about the status of an application. The DAC coordinator will reach out to the researcher after the application process to confirm receipt and provide any preliminary feedback. The DAC project application is then formally reviewed during a bi-weekly DDRC meeting. If the committee approves the application, the researcher is notified on the same day and is provided with more detailed information about the next steps. DAC projects are also assigned to 2 statisticians up to 2 business days after approval. Once the statistician assignments are made, researchers may begin submitting data requests via the DAC Online portal. Researchers who submit their own programs to statisticians can expect to receive results in 5 to 7 business days, while those who require programming services can expect to receive results in about 2 weeks, given minimal back and forth between the researcher and statisticians in both scenarios. To submit a data request via DAC Online, click on the DAC project number in the user dashboard. Then select the Support tab and click on the Create New Ticket button. As mentioned before, all output being transferred out of the DAC and to the researcher must first be reviewed for disclosure risk by the DAC team. This process includes suppressing unweighted cell values of less than 3 and weighted cell values of less than 500. Complementary cells are also suppressed to prevent back calculation in tables.
Excuse me. All right, so for more information about the Data Access Center and how to submit a DAC project, please contact us at dacchpr@ucla.edu. And now Zebri Jiang will discuss using the CHIS macro polling feature.
Hello, everyone. My name is Zebri Jiang, and I'm one of the CHIS statisticians. Today we'll be talking about how to use one of the tools to pull multiple years of CHIS data in SAS. First, you can download the CHIS pooling macro from our website. This is our homepage. We will go to California House Interview Survey, analyze CHIS data, and scroll down to sample code to pull multiple cycles of data. And you can download the CHIS pooling macro from here. And next, I will show how to use this macro.
This video shows how to use the CHIS pooling macro to pull multiple years of CHIS data. If you want to learn the general rules of pooling, you can visit our website for the methodology and also the sample code from this 2 web page here. The sample code will be available for SAS, Sudan, and STATA. For SAS users, we want to present a way today To automate the process, we prepare a SAS macro to do the weight adjustment automatically. The SAS macro can be downloaded from this web page here. And you will be able to download macro from here. After downloading, you will get 3 files in a zip file: the documentation, the sample code, and also the CHIS pooling macro. And I will show you how to do the weight adjustment in 4 simple steps. First, prepare your working data set. Second, call the macro in your program. Third, specify the parameter for your macro, and then run your program. To prepare your working data set, start concatenating each data file. Create a variable called year to specify the year for each data file. The year must be in character format, and the 1-year data, you will need to use the 4-digit year. But for 2-year data files, you will need to use the 4-digit year for the first year, plus an underscore, plus a 2-digit year for the second year. Like the example shown here, 2017 underscore 2018. And don't forget the quotation mark here. The macro is called CHIS pooling and has 4 parameters: the data in, data out, year list, and prefix. The data in and out are just the names for your input and output data set. The year list is a list of years in your working data set. Each year in the list should have similar formats to the working data. For this time, no quotation marks. Each year should be separated by a space. For example, the example here, year list equals 2018, 2019 underscore 20. And the prefix will be the prefix for the adjusted weights in your output data. And by default, we use this prefix. After running your program, you will see the following written to your SAS log: the input data summary and the output data summary, which I will talk in more details in some example in later slides. And a macro variable called rep_n will be generated, and it can be directly used in your rep weight statement in SAS survey procedures. The rep_n represents the number of replicate weights in your output data set, like the example shown here. And next, let's look at 2 examples. The first example using the dummy data file of CHIS 2018 and 2019. Note, both of the files are 1-year data. You will start with calling your data from the folder location. And then you will start to concatenating your data file. And then you will need to specify your year variable here. For the 1-year data file, we use the 4-digit year. And then read the macro from the place where you save the CHIS pooling macro here. And then let's specify the parameters for the CHIS pooling macro. The data in, data out, and the year list is 2018 space 2019, and the prefix. And here's an example of how we can use the output data set. The weight and replicate weight statement here uses the adjusted weights we got from the macro. And the rep_n here represents the number of replicate weights. And here you will see the summary in your SAS log. The year list is CHIS 2018, 2019. We are using 2 data files. And those data files represent 2 years of CHIS data. Both of them are 1-year data file, and we don't have any 2-year data file here. The output data set will include 160 replicate weights, and their variable names are here. And the output also reminds you that you can use this rep-in global macro variable for your rep weight statement. And next, let's look at an example of using the PUF data. This time we use the CHIS 2018 plus the CHIS 2019 and 20. Note that CHIS 20 here, CHIS 19, 20 here are 2-year data files. Again, you start with loading your data from the folder and concatenating your data file and specify your year variable here. Note for 2-year data, we need to use the 2019_20 format. Read your macro from your folder location and specify your macro here. Year list, we have 2018 space 2019_20. And again, your rep weight and rep weight statement here will use the adjusted weights you just got from the macro. And let's look at the SAS log file. We'll see our year list is here. We're using 2 data files here, one 1-year data and one 2-year data. But those data files will represent 3 years of CHIS data. Since 2019_20 is a 2-year data file. And you also show here one data files, one 1-year data file and one 2-year data file. The output will have 160 replicate weights and their variable names here. And also the rep and global macro has been created. And that's everything we want to cover in this video.
If you have any questions, please feel free to email us at the dac.chpr@ucla.edu, and I will hand to Peggy for the final conclusion.
Thank you, Zebri. Thank you to the CHIS team. And I'm going to actually hand it off to Tiffany, who is moderating our questions that have come in, and we'll open up for questions to the CHIS team on the product they presented today.
Thank you, Peggy. We have a couple questions for the team here, and then we have some other questions from earlier for AskCHIS and AskCHIS NE. So let's start with this section first. Can data be modified to be analyzed in R?
I think I can answer this question. So we provide the data in SAS, data, and SPSS format. And we provide some sample code to analyze the data. You can easily convert those data files to the R data format, or you can just read the data from these SAS data from R using some packages. There's also a package in R called Survey R that you can use to analyze the survey data.
Thank you, Zebri. Is there any update on when the 2021 CHIS data will be made available either through the DAC or in the public use files?
Sure, I can take that. Yeah, so data will be publicly available. CHIS 2021 data will be publicly available in early October.
Thank you, Parneet. So those are the questions that we have so far on the DAC. Peggy, should we ask some of the other questions and just go back for a few minutes and see if anybody else? Okay, great. Is it possible to analyze these data or export them at the individual level? I think that question is for Jacob.
So I think at the, the best, I would say if you're looking for individual data files, you'd want to go through a PUF. Keep in mind the public use file it's not going to have, there's certain variables that you might see in AskCHIS that we will not provide in the PUF. You're not going to get any information on geography, but it's going to be just an overall kind of California sample. I think for more interest in that, I would recommend touching base with the DAC and looking at a possible DAC project.
Thanks, Jacob. Can smaller counties that are grouped together be explored individually? Would we require an API key for that level of granular view?
I think that depends on what you're looking at. If you're looking at, if you notice in AskCHIS Neighborhood Edition, we have estimates for every individual county. We don't have those specific kind of county groupings. The reason why we have the county groupings in AskCHIS is due to essentially the sampling strategy and the strata that we use for the counties. We had to group a lot of the rural counties just because they're not heavily populated. So if you're looking at the robust selection of survey questions that we have in the regular CHIS, that will most likely be a DAC project that you want to look into exploring. If you're looking at specifically those health indicators that we have modeled in AskCHIS Neighborhood Edition, then that would be something, either an individual data request or an API license to look into. So I think it kind of depends on the type of project that you're working on and what your needs are.
Great. Also on AskCHIS NE, when you save to your library or you save a search to your library, does it auto save as you edit, or should you save each time?
You should save each time. It's not going to auto save. Good question.
Thanks. I didn't ask it. I don't know why I said thanks. Is it possible to link AskCHIS NE data to census tract level variables available from other data sources?
Within the program, no. There's no way for you to kind of like upload your own custom census tract thing into AskCHIS Neighborhood Edition. It would be something where if you were to do an API request and work with that to look at other tract level information, that's something that you could do. But as far as uploading custom data files into AskCHIS Neighborhood Edition, that is not a feature that we have.
Somebody asked a little bit earlier if CHIS asked any questions related to spirituality or religion or similar variable. I did confirm with Todd Hughes, our CHIS director, and no, we do not ask any questions related to that. So just wanted to clarify that. Is it possible to get a statistical code for queries, for example, STATA codes?
I can answer that. So I'm not sure if you mean query, does that mean the AskCHIS? So the AskCHIS, the backbone of the AskCHIS is a SAS macro we wrote a couple of years ago. And we are not going to release that code. But if you're interested in some sample code to analyze CHIS data, we do have a couple of sample code available online, written in SAS, STATA, and SPSS that can be used to analyze the CHIS data. Either if you are going to use that on PUF data or if you are going to submit your DAC project.
Thanks, Zebri. Can you write a program for that will work for future CHIS survey years, or will the variable names or data structure be changed yearly?
Our data structure, so first our questionnaire will change every year, depending on the needs from the founders and also the research needs. Even the same question will likely have some wording changes in the future years. So the main structure won't change, but there will be slightly change for every year. We add new variables, we drop out variables. So it's a good practice to review your code every year for the new upcoming data.
Great. Are there any future plans to include functions to show statistically significant differences between groups? I think this question is for Peggy.
So you can actually query in AskCHIS and look at comparison with the different populations that you're interested in and see the estimate either under a topic area, which is required to look at differences among populations.
Thank you.
And also I want to add that if you want to do some statistical hypothesis testing using the CHIS data, we do not have this function on AskCHIS, but you are welcome to use that on the PUF data, or you can submit a DAC request.
Thank you. We've got a couple more questions, so if anybody else has questions, please feel free to drop them in the Q&A. Some counties are grouped together. Would it be possible to get the data for individual counties?
I addressed that earlier. I think it kind of depends on the scope of your project and what you're, I don't know if that question is, if it's, you're talking AskCHIS Neighborhood Edition, we do have individual county estimates. The one thing is that, if you look at the health topics, it's not as robust as say AskCHIS. If you're looking at the wider array of health indicators and topics in AskCHIS, that would most likely be a DAC request that you'd want to submit to.
Thanks. For AskCHIS NE, how can you combine different factors? For example, if I want to select multiple races, also, is there a way to display disaggregated data, so different ethnicity subgroups?
So if you're looking at different racial groups, you notice in the sociodemographic section for ethnicity, we're just going with the census defined, they're Hispanic Latino or they're not Hispanic Latino. I know there's a lot of debate with regards to what ethnicity is and the definition of it, but for AskCHIS Neighborhood Edition, we're just going with the simple census definition. When you look at race, then we have more African-American, Black, Asian, etc. All you need to do is in the sociodemographics is you can just add those to your data, to essentially your data table. So you can add, you can see what's the percent of white, what's the percent of white alone, what's the percent of Black African American alone, percent of Native American, Alaska Native, etc. So you can add those to your data table. As far as looking at kind of the subgroups, that's something that we need to explore further to look at, examine the ACS data and kind of make a determination if it's appropriate to look at those other subgroups. But right now, as far as ethnicity goes, we're just looking at Hispanic Latino or not Hispanic Latino. And yeah, I understand that there are limitations with that definition.
Thank you. Some social determinants of health seem scattered among all the available health topics, that is poverty status, educational level, housing status, etc. Will these be consolidated into its own social determinants of health category at some point?
That's a very good question. That's something that I've kind of had an internal debate in my head about. And I think one thing to consider is like how we define social determinants of health. It's such a very expansive subject where I think if we did have a SDOH, a topic area in AskCHIS, it would just be massive. But yes, I do understand that it's kind of like those are intersectional groupings. It's not just race, ethnicity. It's not just gender identity, etc. It's a wide array. One thing I would suggest is look at when you go to the topic section, there's a search feature. Look at using the search feature. Sometimes using the search feature for me can be a lot more expedient for me to just kind of go through and search by, if I want to look race, if I want to look up gender, if I want to look up income, poverty, etc. I would recommend maybe looking at using that search feature, because that can definitely help out. I've got some other ideas with regards to social determinants of health that I'm kind of troubleshooting and brainstorming for. So I'll keep you all posted on that. But I appreciate that question.
And if you have any questions and you want to sign up for our listserv where we do include announcements like these, you can email us at healthpolicy@ucla.edu. I will drop that into the chat in a couple minutes. But before I do, those are all the questions that we have. And we do want to ask you to complete a survey. So I'm going to turn it over to Peggy to close this out.
Thank you. And thanks everyone for coming today. It's really important. This is the first time we've had this full presentation on the different ways you can access just particularly some of these advanced products that are available to you. And we'd really love to hear from you. So if you can click on in the chat box the link to the survey, it's going to help us to plan future webinars on these topics of interest to you. As well as there is a field there to let us know if you are seeking assistance, and our team can reach out to you if you provide your information there, and they'll contact you, provide any assistance you need. And with that, I think that we are completed, unless there's any other questions. And thank you, Tiffany Lopes, who really jockeys the the questions, and those of us that are doing the presentation and answering some of the questions, as well as throwing them to the presenters. It's a really challenging job, but I really appreciate your moderating, and all of the links. If you can save the chat where she's entered all the links, save the transcript. You'll have all of the links to all of the topics that we've discussed today. So thank you, everyone. And with that, I think we can close out. I do want to say, before we close, I want to thank Principal Investigator and Center Director Ninez Ponce, as well as Todd Hughes, who's the Director of the California Health Interview Survey, and of course, the California Endowment for making these webinars and trainings possible.
And just one last thing before we close, somebody asked if this recording will be available to view later, and it will be. It will be available on our YouTube at youtube.com/UCLA-CHPR. If you would like us to send you that link when it is available, you can also email us at healthpolicy@ucla.edu. Thank you so much, everyone.